intersects and filling sidewalk gaps. So we've made some strides over the years, with 2021 being our boldest yet, with updates to policy to provide protected bike lanes or pathways on all arterials, as well as hiring and growing specialized staff to improve our ADA compliance and bike ped safety. But despite these efforts, Ada County and the rest of Idaho has a long way to go. And just this last summer, during the 100 deadliest days, 92 people died in traffic crashes on Idaho roads. And from the start of Memorial Day, that's from the start of Memorial Day through Labor Day. And so according to AAA Idaho, we've seen a disturbing 30-year trend of pedestrian fatalities increasing by over 70%. And while the number of pedestrians killed in rural crashes has remained constant, the number of deaths on busy urban roads grew by 70%, with 68 of the increase on roads with speed limits of 40 miles per hour or faster. So we have a huge problem and we need solutions, which brings me to say why this session with Leah is so important for all of us. So Leah is the founder and director of the Vision Zero Network, bringing 2 decades of proven success, championing movements to advance safe, healthy, active transportation. She serves on the steering group of the National Road to Zero Coalition, as well as the advisory board of the Collaborative Sciences Center for Road Safety at the University of North Carolina. Leah has researched Vision Zero strategies across the globe and has led significant changes on streets and policies here in the US. So Idaho continues to grow at an unprecedented rate. We also have an unprecedented amount of investments going towards transportation in the built environment right now. So we have this brief window of opportunity. And if we want to protect and preserve the quality of life in our communities, we have to learn from Vision Zero practices. So I'm excited to learn new ideas. I'll be watching the recording since we're in the middle of an ACHD commission meeting today. So I'm excited. I hope you all have your notepads ready. In the next 45 minutes or so, we'll learn about the safe systems approach, improving safety on our roads for everyone and all users. So let's get some inside secrets from someone who's been there and done it. So everyone, let's give Leah Shahum a warm welcome.
Thank you so much. Thank you, Commissioner Pickering. Thank you for that introduction. Thank you for your leadership. I've heard a lot about the work you're doing and the work to come. I want to say a huge thank you to Cynthia and everyone with the organizing group and everyone who's taken time. I know it's not easy, especially on this Zoom-filled world we're in these days. So thank you for taking time out today. And it's one of my favorite things is actually talking to folks who are committed to safety like I am. Because the idea of safety is not new, our commitment is not new. And I know we're all absolutely eager and passionate and hungry about finding, frankly, more effective ways to do more and sooner. So thank you for this opportunity. Appreciate it. Great. And I'm going to walk through some slides. There's way too much to cover, but I'd love to cover kind of just give you a sense, a little bit of kind of, I think folks know what Vision Zero is, but a little bit of base of what Vision Zero is, in particular, how it differs from the traditional approach to traffic safety, and really what we're learning in these early years of Vision Zero in the US. And I think what Idaho can really be a leader on kind of in what I consider the next phase, because we have learned a lot. So there's a lot of improvements we can be making. So I hope you all will help in that. And I also want to say a big thank you to the Ada County Highway District. I know you all are thinking a lot about transformative change to safe mobility, and I hope this is helpful. So yeah, let's start a little bit with some of the numbers, and thank you. The commissioner did reference this, as I'm sure others have. Why are we here today? In simple terms, we have a public health crisis in this country. Last year, 42,060 people were killed in preventable traffic crashes in the US. That's all types of folks: walking, biking, driving, riding scooters, transit, etc. And these are preventable traffic crashes. I really want to emphasize that. And it's going to be a big part of my sharing today, is really switching our mindset to these kind of inevitable, quote unquote, accidents to preventable crashes. And as was mentioned, Idaho is right there with the rest of the nation. Unfortunately, we've seen an increase in traffic deaths nationally, I should say nationally. From 2019 to 2020, we saw an uptick of 8% more traffic deaths, even though there were fewer trips because of the pandemic. So when you look nationally at the traffic death rate, from 2019 to 2020, the traffic death rate increased 24%. And as was referenced, it's particularly people walking that are at risk. And I pulled this information from your transportation department just to put it in perspective. These are some statistics for the state. We won't go through them all, but just to really think about this, that a person is injured in a traffic crash every 46 minutes in the state, and a person is killed in a traffic crash every 41 hours. So we know this is a pressing problem and one that affects every single person in the state and in the nation. And I want to just start a little bit with who traffic dangers hurt the most. Sadly, it's our most vulnerable. I was surprised to learn this a few years ago. I've been doing traffic safety for a long time, but I had not realized this, that traffic deaths are the leading cause of death amongst youth, ages 1 to 19. That's phenomenal to me. If you think about our most, I think, precious and vulnerable, members of the communities, what are we doing to keep them safe? And that's really, I think, what's motivating a lot of us, is that we know we can do better. And again, as was referenced, we know that traffic deaths are increasing significantly amongst people walking. We know that older adults, along with kids, older adults are also more likely to be killed while walking. We also know that there are racial disparities, sadly, that Black people are about 80% more likely to be killed by drivers while walking than white non-Hispanic Americans. These are national statistics. I want to credit Smart Growth America. They have a wonderful report called Dangerous by Design. If you're unfamiliar, check it out. It's really valuable. We also know that people walking in low-income communities are about 3 times more likely to be killed by drivers in high-income areas. So I'm sharing some pretty, I think, distressing news. I think I'm going to switch now to looking ahead more. What this tells us, though, is that we generally know where we need to be putting our attention. And I want to highlight this one for a second, that people walking in low-income communities are about 3 times more likely to be killed than in high-income communities. Does that have to do with the people themselves or their habits or behaviors? No, when we drill down, what we see is that these neighborhoods, the physical environment, the low-income communities, are more likely to have high-speed traffic, more car traffic, more freeway touchdowns, fewer sidewalks, fewer bikeways, longer distances for people to be traveling, say, to the grocery store, et cetera, et cetera. So there's a very clear systemic connection to why these communities are more at risk, and we'll talk more about that. But really connecting that to, again, something distressing, but hopefully also hopeful or optimistic, is that we get the results we design for. When we design for predominantly faster moving car traffic, moving again at high speeds, especially in dense areas where people are walking or biking, but also in rural areas, we'll talk about this, that we really know what to expect from these high speeds, and that's more crashes and more severe crashes. Again, I'm going to turn it more hopeful now, is that we can make change. I think part of what Vision Zero, and let me pause and make sure that I do define it clearly, that Vision Zero is the goal of 0 traffic deaths or severe injuries among all road users. So not just people walking, that's certainly one, and biking, of course, scooting, et cetera, but also people driving, riding motorcycles, of course, riding transit, it's everyone. The good news here is that we can make change. Part of what Vision Zero does is helps us really drill down even more into the data, really understand the data. And that's how we're understanding even more about, for instance, youth, people of color, low-income communities being disproportionately at harm. It also helps us understand what we can do to make change. So I'm going to talk through that a little bit. Great. And this is probably something a lot of folks have seen, but a high level, very high level summary of how Vision Zero differs from the traditional approach. And let me pause just by saying, it's got a snazzy name, the goal of Vision Zero. Who doesn't want 0 traffic deaths, right? Raise your hand if you're against safety. No one's going to raise their hand. Of course, we all are. So what does Vision Zero really mean? And I want to first start by saying it's important to recognize it's more than a slogan. It's more than a tagline. It's more even than a program. Vision Zero is a transformative and very different way of doing things. I would call it a paradigm shift from our traditional approach. And I'll just highlight a few of those ways. And I referenced before just that power of 0. So in the traditional approach, you'll see that you'll notice that we've really designed or set goals for safer. Let's be safer, a little bit, 10% fewer traffic deaths, or a little bit, as much safer as we can be. What Vision Zero is saying, and it's pretty different, is, hey, all traffic deaths are preventable. We want zero traffic deaths or severe injuries among all road users. Now, is that very ambitious? Yes, it is. But just to pause and think and say, when we think about other public health crises, whether that's, we'll choose anything, any sort of illness or societal problem that is causing unnecessary deaths, we don't think we want a little bit better, right? We want to aim for safety for everyone. So really thinking about what can we do to make sure that we can ensure safe mobility. It's not cutting off mobility. We want mobility. People should be able to drive, walk, bike, take transit, et cetera, but they should be able to do so safely. And I'm going to skip down a little bit to part of what this is the systems approach. So really shifting or evolving past this idea and the traditional approach of individual responsibility. Traditionally, we've spent a lot of times, teaching people, hey, you need to drive safely, walk safely, bike safely. And that is still the case. No one should stop thinking about their own responsibility and their own safety and the safety of others. But we need to be spending a lot more time on the systems approach, which is really looking upstream. And those systems are the built environment, the roads, the streets, the sidewalks, or lack thereof. It's the speeds we set. It's the communities. Land use, of course, is very connected here. And then popping back up on this, second one, we really want to integrate human failing in the approach. And that sounds a little funny, right? Why do we want to think about human failing? Well, it's because we know humans are fallible. We're going to make mistakes. So let's not pretend otherwise. When we're building our systems, when we're designing that road, setting the speed, even designing the car at that higher level, we really want to understand that people are going to sometimes make some mistakes, whether that's conscious or not, at fault or not at fault. They're going to make mistakes. So how do we make sure that the system we're moving in is one where people can survive mistakes? So that's really a high level picture. And if you had told me about 7 years ago that communities in our country, in the US, would be committing to this very ambitious and very measurable goal of zero traffic deaths, I might have been I would be very skeptical, to be honest. So I'm happy to say I was wrong, and I'm very happy to be wrong. And that communities across the US are committing to that very measurable and very public goal of zero traffic deaths. I want to give credit, started with New York City, San Francisco, DC, Seattle, but I want to emphasize, those were some of the first ones, but I want to emphasize that it's not just the big cities. Macon, Georgia was one of the first Vision Zero communities. Fremont, California, kind of a mid-size, more suburban community. Places like Laredo, Texas, and Fort Lauderdale, Florida, much smaller communities. And I want to emphasize that Vision Zero as a concept started in Sweden about a little over 20 years ago. And it really began in rural communities because they were seeing so many traffic deaths on smaller one-lane road, or two-lane roads. Vision Zero started in a rural environment. The principles I'm going to talk about were really based in a rural setting. It eventually, and for drivers in particular, it evolved to include more urban areas and suburban areas and more walking and biking, but it started with that rural driver interaction. So again, I want to emphasize that to show this is not just a big city or not just an urban issue or approach. Really at the base of this, and I'll say there's two things I'm going to emphasize. Here's one, the second will come later, but one thing I hope you'll walk away with from this discussion is this concept of crash, not accident. Sure, they're just words. Do words really matter? In this case, they matter a lot. Even in our own profession or our own advocacy and our own families, communities and such, to really be thinking about calling these traffic crashes. And I think part of this is symbolically showing, hey, these are not accidents like a meteor, falling out of the sky and no one could have seen that coming. It's completely unpredictable. The reality is, and we'll look at some of this, what's happening on our streets and sidewalks and bikeways is largely predictable and largely preventable. I think there's been a real misunderstanding for myself as well for a long time. So part of what Vision Zero is helping us see with this data-driven approach and more of a focus on the systems rather than the individuals, we're saying, hey, we can prevent these severe crashes. There'll still be crashes. Vision Zero doesn't mean zero crashes. We're still going to have people, do something stupid or just make an honest mistake, right? People are going to do that. But can we minimize the severity of these crashes? And again, switching so that we're not calling them accidents. We do have agency, both as individuals and what I'm going to focus on as system designers, as influencers, as policymakers. So really looking at what are our responsibilities and potential roles to think about those systems. So again, on this systems approach to safety, I'll kind of start high level, and then I do want to make sure I get to some examples to show you communities doing these things. But at the high level, this is a great graph developed. We've kind of monitored or merged it over to traffic safety, but this idea is created by the Prevention Institute, a public health institute. And they use this systems approach to safety, again, an upstream approach to safety for major health crises. And again, if the leading killer of youth is not a major public health crisis, I don't know what is. But really what this is showing is we have these different levels of strategies and actions, right? In the blue at the top, you'll see influencing policy and legislation, changing organizational practices. Skipping down to the bottom, the yellow, you'll see promoting community education and strengthening individual knowledge and skills. So for the world of traffic safety, those yellow areas, they're very important. Again, I don't want to minimize the need for people to know their responsibilities and their rights and to learn those. So, that's things like, hey, everybody be careful, look both ways when you cross the street. Obviously, don't drink and drive, all these important things that we need to be doing. We've placed a lot of emphasis there, though, and frankly, so much emphasis there that we've really neglected the upstream approach, which here is influencing policy and legislation and changing organizational practices. These are upstream, but they're also harder. I want to be honest, they're going to be, well, they're all hard, but this is going to take some real paradigm shift, but this is where we're focusing with Vision Zero and with the safe systems approach. So when it comes to traffic safety, what does influencing policy and legislation mean? A lot of things. It could mean having a citywide speed limit lowering. So, in the city of Boise, say, in your downtown district, are your speeds set at survivable levels, especially for people outside the vehicles? And we'll talk about what survivable levels are. That's a policy. That's something that probably your city council or state legislature needs to decide. That's not something me as an individual walking on the streets or driving can do, right? The safe speed set needs to be done by policymakers and designers. Ditto with how the street is designed. Are there bikeways there? Is there enough crossing time? Are the streets designed safely, et cetera? So I'm emphasizing this to really show, we're looking for the upstream ownership and responsibility of safety even more than we used to. So here's another image that I think helps portray this. So on the bottom right, you'll see individual road users. Again, I want to emphasize we're all responsible for following the rules of the road. Yes. Next, on the bottom left, you'll see sometimes road users are going to make mistakes. Let's not pretend otherwise. I mean, if we pretend everyone's perfect, we will keep having the problems we're having of 42,000 traffic deaths a year, or perhaps more or less, but too many traffic deaths. Really what we're trying to shift to is up at the top of the triangle here, is that we're helping give system planners and policymakers, frankly, more political support to prioritize safety in their designs and policies. Now you might stop and say, well, Leah, of course we've been doing that. We've always wanted safety. Designers aren't planning for unsafe roads. And that's not what I'm suggesting, but we've had a culture, frankly, and sometimes we have laws on the books and sometimes we have precedent and all sorts of things that have not always made safety the priority. So what we need to be doing is supporting those planners and policymakers in doing that. I'm going to give some examples. And this is a great one, I think. I borrowed this from the St. Petersburg. This is St. Pete, Florida. I should have mentioned or been clear. The mayor of St. Pete, Florida, where they're working on some great complete streets work. I really appreciated this note from him. And I'm just going to read this because I think it's really helpful to think about the difference here or the evolution of thinking. He says, driving too fast is an epidemic which not only causes crashes, but leads to more serious injuries and deaths. Furthermore, drivers who drive too fast cannot bear the full blame. This is because that's how engineers, planners, and city leaders here and in other cities have designed roads for decades. We invite people to drive too fast. Now, the reason I'm sharing this is not to say drivers don't or those on the roads don't bear responsibility for the behavior, but we also need to be thinking, how do we, again, as planners, engineers, policymakers, shift this? shift the environment they're working in or driving in or walking in or biking in. So part of that is really pivoting to the safe systems approach. So we're all, I'm sure, familiar with the E's, the traditional E's of education, engineering, enforcement, et cetera. Those are all still important. We need the E's. I think more and more people, thankfully, are adding in equity, engagement, evaluation. There's a role for all the E's. But I think what we've seen, and I think more and more people are agreeing, is that the E's can be too siloed. Oh, that's a police problem. You guys deal with that. That's an engineering problem. You guys deal with that. When in reality, there's a lot more collaboration that's needed and shared ownership. So we're really encouraging this kind of bottom design of safe streets, safe speed, safe vehicles, safe people. And there's a role for the E's to play in all of these. I also want to emphasize that we really recognize that not all the E's are created equal. And by that, I mean, we cannot lead with education and enforcement. Again, that's putting too much onus on the individual to do the right thing, even if the environment they're moving in is not designed to do the right thing, right? There's too many cases in which the environment that people are moving in is actually designed for less than safe behavior. So we really want to be leading with engineering, and that really is around streets and policymaking around speeds. And I just want to step back a second and give some credence to this idea of the safe systems approach, because it is a significant shift. It's not bucking away from the E's. I would call it evolving past the E's. Again, all the E's are important, but they're put in a little bit of a different order and different emphasis. So we are not the only people supporting this new approach of safe system. I want to really show how mainstream this is. That U.S. Department of Transportation, the Federal Highway Administration, is officially promoting safe systems. This is from their website, and check it out. They have a lot more on their website. But just to be clear that Federal Highway, FHWA, has set zero as the goal. And again, they're saying vision zero is the goal and a safe system is how we get there. I won't go through all this, but I encourage you to check out their website. But you'll see these same concepts I'm kind of talking about here is, hey, humans make mistakes. Also, humans are vulnerable. Our bodies can only take so much in a crash. So really understanding that and designing for that so that when people make mistakes, that mistake is not fatal. And really what this comes down to is about design. So designing for safety over speed, designing a safe system. And again, I really want to emphasize this is not trying to put all the responsibility on the planners and designers. Yes, there's a lot of responsibility on them, but what we want to do is really as a community show that our values are safety, especially for our kids, especially for those that are most vulnerable in our community. And if we believe that, if those are our values, then how do we support and encourage safe design? And a lot of that means, hey, we're gonna need to be ready for some changes and support some different activities on our streets. Part of that I'm going to talk about just two is managing speed for safety and also redesigning streets. So these are not new concepts. Everybody listening on this call knows this probably better than me. Complete streets, the value of designing for safe streets, and then the value of managing speed for safety. I mentioned earlier if there were two images I could show. One was that crash not accident, just to kind of get that in everybody's head. The second is this graph at the bottom, which is a really, very simple, maybe simplistic, but I think jarring or maybe powerful image. Folks have probably seen a variation, but an average person, I'm relatively average build and healthy and again, pretty average. If I'm hit while walking by a motor vehicle traveling at 20 miles per hour, it's estimated I have a 90% chance of survival. So decent odds. That car moving at 30 miles per hour, I've now cut my chances of survival significantly. I only have a half chance of survival. And at 40 miles per hour, if I'm hit, I now have a 90% chance of death. Those are dramatic differences. So just to pause and stop right now and think about your own community, whether it's rural, urban, suburban, whatever your community is, what are the speeds set at? What are the roads designed for? How are the lights, street lights timed? If there are people walking and biking, and it's not just a vehicle throughput area, right? If there's a mix of people walking, biking, driving, inside the car, outside the car, we should be setting our speeds and designing our roads and setting our light timing, et cetera, for 20, 25 miles per hour. And that is a really big shift. And that's something that, obviously gets pushback because people think, I want to get there faster. I want to get there faster, right? Unfortunately, there are a lot of places that still are holding on to the 85th percentile practice of setting speed, when in fact, the federal government says that's not how you have to do it. And in fact, that's starting to change. There is a real shift. For instance, the National Transportation Safety Board has recommended or very clearly recommended shifting from the 85th percentile speed setting method, which I won't get into it too much because it's so darn wonky, but it's important. It basically says, in a way, it says, hey, let's see how fast people are going right now. And then we'll set the speed based on that at 85th percentile of that. So it's a very shorthand way of saying it, but instead we should be using a safe systems approach, which says, hey, what's the context of this road? How is it being used? What's the crash history here? Who are the road users? Do we want people walking and biking? Are people going to that grocery store, that bus stop across the street? Are there opportunity or are there risks of more crashes and such? So really thinking about the uses rather than this, I would say very outdated, and NTSB even says ineffective way with the 85th percentile of setting speed. So let me get off that wonkiness. The second big area, this is not all of them. The second big area, of course, we can control in the most upstream and systemic way is designing complete streets. And I'm going to pick on my hometown here of Jacksonville, Florida, suburban area in northern Florida. These are both pictures pretty close to my family's house and where I grew up. But in the top left, you'll see these kids walking to school. And it's great that kids are walking to school, right? They're lucky they have a school about 3 blocks away. Gosh, not far at all. 8-minute walk maybe for these kids. This is an elementary school. They look like they're kind of older elementary, but there's no sidewalk on this street. You look and go, well, it looks like a pretty calm, mellow street. It's actually not. Having lived there for quite a while, people drive really fast on this street and there's no sidewalks on either side. So back to the point of, can we educate these kids to do the right thing, or could one enforce walking on the sidewalk? Well, not in this case, because they don't have that choice, right? They literally do not have the safe environment to walk in. My stepdad worked for years trying to get sidewalks here and still didn't get it. And down in the other one, obviously biking in a very precarious looking location. So really thinking about, okay, what's the built environment that's welcoming people walking, biking, and driving? Let me say, nobody driving wants to be at odds and endangering others either. So really thinking about all road users here. And just wanted to show some images from Alexandria, Virginia, which I would call one of the Vision Zero leaders in the community or in the nation. And they're really doing a great job of redesigning their streets. I realize these pictures don't show a lot of people. That's always a little distressing, but they're really switching from, what I would go back and say, okay, actually looking ahead here, what you see on the top left, some images here with that Virginia picture, but maybe moving on the example of pedestrians, looking at this image in the top left, this is also from the Dangerous by Design report by the Streets, blanking on their name right now, Complete Streets Coalition. They do a great job with this, but really emphasizing this point again of built environment and individual behavior. They obviously go very much together, but we spend a lot of time on the behavior. How do we spend more time on the environment that affects the behavior? And they ask this question, are distracted pedestrians really the problem? And again, I'm not saying somebody should be distracted. Everybody needs to be careful when they're walking, biking, driving, but too often we put the onus on individuals, and you see people actually here walking and biking in really subpar conditions, right? There's no sidewalks, or they're running across what look like very, very big lanes of traffic or streets of traffic, multi-lanes. Now, would they like to have a bike lane? Would they like to have a sidewalk? Would they like to have a crosswalk more regularly? Of course, probably, right? So are these folks at fault? Again, back to this issue of we get the results we design for. So if people are making bad choices, quote unquote, unsafe choices, a lot of times it's because there's not the easy, safe choice in front of them. So it really comes back to us as system designers and planners and policymakers. I'm going to skip ahead for sake of time here because I know, and here I skipped ahead with Alexandria, again, some example of better design. So really hitting on this idea, and I think this is a concept I know that national folks are re-examining and eager to maybe put right, is this kind of myth of this 94% of traffic crashes are caused by human error. I won't get into the study of that from many, many years ago. Actually does not say that at all. It's really been misinterpreted. But what I want to jump to is to say, hey, we shouldn't be emphasizing so much this human error piece. What we should be saying is, how do we make the street design and the speeds that lead to fewer and less severe crashes? And really this is the environment that people are going to make their choices in and make their behavior in. So just want to call that out, because I know we see that 94% statistic a lot. And even the feds have, I think, disowned that, but we want to see them do that more publicly. But that's a little example. So really, when you get into the data, and I just shared one example here, I could share this from almost all the cities we work with, but what we see is that traffic deaths and severe injuries are concentrated on a relatively small percentage of streets. For instance, 50% of the traffic fatalities in Denver occur on just 5% of the streets. And this is a first step for Vision Zero, by the way. If you don't already know the data connection of like where the severe things happening, it's really important to map that and to be able to share that publicly and talk about it. I highlight Denver because they took that information as power. And I won't get into it now, but we have a whole webinar on this, but really showing how Denver's doing a great job of creating an action plan and then tracking their items and really emphasizing where the problems are happening and focusing their finite resources there. Nobody has enough money, right? You're never going to have enough staff and money to do everything you want to do. So how do you really focus it on those most problematic locations? I'm just going to spend a second on some cities. New York City, I know, is not like anywhere else in the country and certainly not like Idaho, but I do think they deserve credit. They've really been, well, they were the first to do Vision Zero, but also the most ambitious, and they've seen a significant decrease in traffic deaths. In their first 5 years of doing Vision Zero, they saw about a 30% decrease in traffic fatalities, huge number. But I want to go to some that I think are maybe more relatable. I mentioned Fremont, California. It's a community in California of about 260,000 people, very suburban, very, I'd say more car focused traditionally, but they've really done a lot around focused on redesigning streets, lowering speed limits, retiming lights. And I want to quickly show you that since they started their Vision Zero program, their traffic deaths are down. Oh, sorry, severe injury and fatal together. Their major traffic crashes, both fatal and severe injuries together, are down 45%. So really impressive. And I think they're a great one to look at as a model. We also have information about Fremont on our website, so check that out. Some others, I cannot say that their numbers are showing this yet, but they're newer. Charlotte, North Carolina, just to show again, community in the South, more suburban style, et cetera. They're lowering speed limits. They're adding traffic calming. And this is part of their Vision Zero commitment. And I want to emphasize what Charlotte's doing and Fremont and others. It's not creating a whole new toolbox. There's not some magic wand, of course. What they're really doing is, I'd say, bringing more political will and more public attention and emphasis on doing what works, really doubling down on what works. So that is speed management. It is investing in street redesign, even when that means, people are going to drive a little bit slower. And that is, if you want to call it a trade-off, let's call it a trade-off, but that is the decision that needs to be made here. And finally, just wanted to share this little image. We did some analysis based on other people's good analysis, everybody from AAA to Consumer Reports to other groups, to show that right now, this is a national number, but with the technology that exists today, with the know-how, political and practical know-how of strategies, we could save about 75% of traffic fatalities, prevent 75% of traffic fatalities. So what we have in-house today is estimated to be able to save 31,000 lives a year. And that does not count what's coming. Of course, technology is improving and there's more to come. This is really to emphasize that zero is possible. What we need to be doing is making the tough choices, showing the political will, and redesigning our system to prioritize safety over speed. And won't get into all this, but again, we have a lot on the website. If you'd be interested in more of a how-to, this is again about much more than the technical tools. Sure, there are technical pieces, but it's much more, frankly, about the leadership and commitment. It's about the high-level commitment and really engaging community. It's about thinking about being proactive and how to really be evaluative about what works. So it's a lot more about the how. And just to wind down here, this is possible. Again, zero is possible. I know these are different places, but both the cities of Helsinki and Oslo, hardly amazing warm weather, but they have literally cut traffic and or pedestrian and bicyclist deaths in the year 2019. And those are the first big cities that we know of to do so. And we've really learned that the way they did this is through the Vision Zero principles we've talked about here today. I'm going to wind down there and open it up for questions, but my contact info is here. Love to answer more questions offline anytime too, and check out our website. And I'll hand it back to you guys. Thank you.
Thank you, Leah. We do have some questions coming in. Let's see. I think the first one is coming regarding Compass, which is our regional metropolitan planning agency. They adopted their complete street policy in 2009. How long does it take a policy to become the norm?
Great question. Oh my goodness, very open. It really depends how much they're going to institutionalize the policies, right? I think we're all familiar with amazing planning processes, right? You could do an amazing planning process and have all these great ideas on paper or on screen. It's really a matter of turning those, the ideas into action and institutionalizing. I'll say some of the things we urge most in a Vision Zero plan or any plan, whether it's complete streets or other, is really to break it down into, the actions, who's accountable or who's going to own that action, a time frame, a budget. Let's not pretend these things happen in a vacuum without funding. And even if you don't know where the money is going to come from, to say, hey, here's an action. We think this is near term. So let's say 1 to 2 years. And our US DOT, or I don't know, the city DOT owns it or the MPO owns it. And we expect this to cost about $1 million, and we don't have that source funded yet, but to really lay out the measurables so that there can be a really clear transparency and reporting structure. So they should be coming back to the MPA board or commission, is it quarterly? Is it twice a year? I'm not sure, whatever makes sense, but to come back and say, hey, here's what we said we would do. Here's what we've done. If we haven't met all these goals, here's why. We need more money, or we need more support, or we've shifted this way for some reason, but to really make this a transparent process. And I think part of this is, how do we take out the magical thinking around traffic deaths? These are not, we've become complacent in this and no fault of ours. It's very much the way the media talks and others, but we can change the system that this is in. So I think your plans have to really reflect that as well. They're not just, good thoughts on paper, but actionable items being tracked and measured.
Mm-hmm.
Yeah.
There was a question along with that one that has come up on some conversations I've had recently. And it's asking about the disconnect between policy and road design, and if the policy is there, how do you make sure that the road design is also there? And do you have any insight on that?
It's a great question. And I think something we struggle with a lot. And let me say this, I am a huge fan and supporter of complete streets. And I'll say, when I started working a lot on Vision Zero, one of the first calls I made was to people working a lot in complete streets and said, we don't want to compete with this. We want to build it all in. So I say that just to say, I think one of the things we've recognized, like many areas, but with complete streets, is you can have a policy on paper that doesn't get translated in every case, right? And is it because people are bad and don't want to do it? Of course not. It's because in every case, there's usually challenges, right? Oh, if only we had more room, or, oh, some state standard won't let us do that, or makes it hard. There's good reason it's not easy. So I step back to say, complete streets is within Vision Zero. I think what Vision Zero does, if done properly, is frankly, and I haven't used this phrase yet, so let me know, it brings the moral imperative. Because yes, does everybody want complete streets? Yes. Does everyone want their loved one, their neighbor, their coworker not to be injured or killed in a traffic death? Absolutely, of course. Now, there's some more urgency for complete streets. So that doesn't mean it just happens overnight, but I will say that I think it's important to bring that kind of ethical imperative to the work, to say, okay, now we have to build these complete streets because it's life or death. Now let's look at that question again, that idea that we don't have enough space, or that people don't want to be slowed down, or we're going to hurt the level of service here. Those are questions that have been asked for a long time. Let's ask them now in the context of life or death. and again, I'm being a little dramatic there, but it is a shift, you know, for our decision makers. And I know there are commissioners and others on the phone. You know, your job is very weighty. And yeah, we are going to be we need to be asking questions in that context. It's more important to be moving people safely than to be moving people as fast as possible. That, you know, I morally believe that's true. We can let others decide how they feel, but that's the question that should be asked. I hope that helps.
No, I think that's great. And this next one is a comment, but I think it's such a great point on that Elaine, our city council member here in Boise, made. Complete streets can have sidewalks and bike lanes and still not be complete in her mind because the design doesn't make the sidewalk or bike lane safe and attractive to use. And I do think that's such an important other step to creating a truly complete and safe street.
Yeah.
Are there any other questions? We have about 6 minutes left with Leah. Thank you again so much for coming down virtually.
I have a question for Leah really quickly. You know, when we would talk to stakeholders about the need for non-motorized infrastructure engineering, we were always told, sure, we need to get the roads done first. And once we get all the roads done, then we'll go ahead and take care of you bikers and walkers. And I guess I don't really know if there's a question in there, but just a point that, you know, the way you talk about this and the way you suggest, you know, let's talk about our neighbors and friends and family members and change that conversation. And it's a slow change, you know, it's going to be really hard to make that shift in stakeholders' minds that we need to design our roads differently.
Absolutely. And I'll say, I want to give huge credit to, I don't think I mentioned during this, but an amazing group of folks called Families for Safe Streets. And this is sadly a growing movement across the nation. These are individuals who've either been involved in crashes themselves, they are victims, or more likely they've lost loved ones. These are moms and dads who've lost kids, people who've lost husbands and wives and parents. It has humbled me to no end. I mean, I've been working for safety for about 20 years, kind of from that walking, biking perspective. And I see things I'm lucky I've not had those experiences. I see things so differently now working with these people who have had the ultimate, you know, life experience with this issue in such a way that I know I'm able to think about this in more urgent terms. And frankly, sometimes get beyond the policy wonkiness, knowing that's still important. You got to have the policy stuff and the design stuff. But I just want to say, you know, a huge thanks to those who are willing to share their stories or their voices. If any of you are on the call, thank you. But you know, also for advocates on the call and for city leaders to really think about taking time to listen to and lift up those voices. Because, you know, I think you're absolutely right, you know, Cynthia, that, you know, it's hard to break through so much, so many priorities out there, right? And decision-making can be hard. I don't want to make all this sound simple, but when you really do hear from folks deeply, deeply affected and, you know, and just lives jarred, it puts this in context. So I think we can all do a better job, frankly, even if we're more on the technical side, to bring this back to what does that speed limit change? What does that street design change? Oh, a 5 mile per hour difference. Let's say it's going up. Let's say it's going down 5 miles per hour. We expect drivers to go 5 miles per hour slower because of this design change. That's life-saving. That may be the difference between a broken leg and death. So let's be talking about that. I know can be stark and a little bit jarring, but it's real. So I'll stop there.
We have one more question that came in, and I think it'd be great if we could just cover it real quick because it's a topic that comes up all the time in our community. Can you address more about the constant battle between transportation engineers saying 85th percentile is a standard versus it only being a guidance with other adopted methods?
Sure, yes, and it is a constant battle. It's interesting. So I am not an engineer. I'm just saying that right now. And sometimes some of these technical pieces make my eyes glaze over a little bit, but it really, this one's really important. It's been interesting to learn that the way some states set speeds harkens back to this process, the system that was created literally like 100, no, it was like, yeah, early, like 1940s. So yeah, early 1940s, almost 100 years ago, was it 75, 80 years ago, when there were far fewer cars on the road. Pretty much only men were driving at that point. These are early days, very, very rural America, et cetera, very different world. And this 85th percentile speed setting was set, again, where it's looking, I'm oversimplifying it, but the basis is that you go out on a road, you measure it and you say, okay, people are going 45 here. We'll set it at 40 or 45, whatever 85th percentile is of that. And it really was intended to be kind of following with what the norms were. Well, let me just pause it. If we followed the norms of everything, think about if your kids, if you asked your kids 5 nights a week, what do you want for dinner? And they said ice cream, like 4 nights out of 5, would you give them ice cream, right? Or if, your teenager said, what time do you want to get home at night? I'm going to get home at 1 a.m. Would you say, okay, no, midnight, even though really 9 o'clock is the right answer. Anyway, that's a weird way of saying, we don't look to actual behavior on things to necessarily focus us on what we should be doing, right? And I say this because street design is really important, right? If we design the street for 45 miles per hour, if we sign the street for 45 miles per hour, if we time the lights for 45 miles per hour, people are actually going to go more like 50. We all know that. And some are going to go much higher, but some will go 45, some 50, some higher. Well, what is the real design? What should that be for the street, right? So let's step back and say, again, if there's a bus stop here, if there's a bevy of stores, a school, a housing development here, right? And we want people to be able to cross the street, then we shouldn't be setting that speed at 45 miles per hour. Now it is, I do want to say it is more complicated than just setting speed. I want to be clear that I'm not just saying, oh, check, you've also got to design the street and such. And that's a harder part. So it shouldn't be that much harder, but we can. And I want to mention pilots real quickly as something that we can be doing. Like, hey, before we necessarily invest all the money and all the energy, pilots, design a trial for something. You can make a 4-lane street into a 2-lane street with a turn lane. You can do that with temporary materials, good sturdy temporary materials, and test that out for speed and lower the speeds and change the light timing. You can add crossing time for pedestrians. There's all sorts of things I won't get into technically, but again, this 85th percentile, it's certainly not the law, but it's been adopted as the law sometimes because people just don't know the difference, honestly. It's kind of an easy way to do things, but it's overused. It's true. And even the feds are thinking about how to change that. So I think change is coming, but you don't need to wait for that. We certainly could do it sooner. And if there's one thing, we could all think about doing is, how do we back to the storytelling or sharing stories is say, hey, if we were to redesign this street and lower the speeds by, I don't know, let's say average 8 miles per hour, I'll make that up. What would that mean? It would mean a safer street, and we could actually measure, or we could predict that. It would mean a safer street by this amount. It would also mean people are driving X%, or it would take them X% longer. We are usually talking like minutes, maybe seconds, maybe 2 minutes, maybe 5 minutes. Yes, it might be slower, but really to put that, I would suggest people do the math and say, okay, we could save so many lives, and the average person's driving X minutes longer. Yes, there's a trade-off there, but you decision maker, you decide, you can all decide what we think, but let's put it in those stark terms, right? Because that is the reality of how we're working. Sorry, that was a long answer, Nina.
No, that's totally okay. And boy, I saw Molly had a question and now she's not in her video. Oh, there she is. Molly is one of our board members, so I couldn't resist letting her ask her question just before we go into the break. So Molly, you can take it away. Oh, you're muted.
It's actually a comment and a call to minor action. But when I hear on the radio or TV or reading the newspaper, accident, I try to contact that media source and say, it's not an accident. How do you know it's an accident? What you know is it's a crash. That's all you know. You had an event, an incident, a crash. And if more of us, when we hear it or see it, reach out and try and get it changed, I think we can start to change that little bit of the paradigm.
Thank you, Molly.
Absolutely. That's great ongoing homework for all of us. All right, so with that, we are going to take a break and we will be back at 2:30 for our panel. Leah, thank you so much again for virtually coming to Idaho, and we really appreciate your time.
Thank you. Thank you all for your work.